This PowerPoint describes types of research evidence that you need to be aware of. An important premise in evaluating the quality of clinical research evidence is understanding that different study designs may be needed for different types of clinical questions. We'll talk about this idea a lot more as the semester progresses. So it's therefore important to understand different types of research evidence, how they can inform your future practice, and also the limitations that are associated with these levels of evidence. This slide depicts something known as the research evidence pyramid. You can see the largest amount of evidence that's available is at the bottom of the pyramid, and for us, narrative reviews, expert opinions, and textbooks fall into this category. As we go up to increasingly more important evidence, we see the next level are known as case studies, followed by case series, case control studies, cohort studies, randomized clinical trials, as well as systematic reviews. Again, the highest level of evidence in the research evidence pyramid are systematic reviews, and these systematic reviews also comprise the smallest amount of research that's available. As we go through this PowerPoint, we're going to talk about all of these different levels of evidence. It's also important to note that evidence-based clinical practice guidelines can be drawn from all of these levels of evidence. At the end of the semester, we're going to talk more about clinical practice guidelines and why they're important for your future practice. Starting at the bottom of the research evidence pyramid, we have narrative reviews, expert opinion, and textbooks. Remember, this comprises the largest amount of evidence that's available for us out there. However, it's not the best. It's mostly useful for background information. And here I've shown a picture of a textbook. This is a pathology textbook. So an example of using this level of evidence would be to just understand some sort of pathology that your patient has. It doesn't tell you how to treat the patient, it doesn't tell you the best way to treat the patient. There's not a whole lot of science in there, but there's a lot of information. So it's just knowledge level information in which the author's bias may heavily shape the information that they put into their textbook. Here again is our slide showing the research evidence pyramid, and I've highlighted the bottom rung, narrative reviews, expert opinion, and textbooks in yellow to indicate that we've covered it. Now we're going to move up to case study. While you can use a case study to inform your treatment of a patient, it's usually not the first choice for evidence, but it is acceptable to use case studies. A case study is simply an N of one. That means that it's a study that was only done on one patient. It just tells you the story about how this individual patient, who may have been treated in a unique way, may have an unusual kind of pathology, but it doesn't tell you about how this particular situation will apply to others. It's simply one person's story. And again, back to the research evidence pyramid, you can see we've covered the bottom two rungs and are moving up to case series. A case series, as the name implies, is nothing more than several case reports put together in a single manuscript to help show how a particular intervention or a particular kind of unique pathology was treated. The case series has more than one person that was treated, but it's usually less than 20. And it is a valuable source of evidence. It is just one rung up from the case study. As we continue to climb up the research evidence pyramid, you can see that we've covered 3 of the bottom rungs and are moving on to case control studies. So what exactly is a case control study? Well, if you look at the picture on the right-hand side of this slide, you can see that the study begins at one point in time, but to actually do the study, you look backwards. As you go backwards from the beginning of the study, you see outcome is listed next. And under outcome, you have two green ovals. One says case and one says control. Hence, case, control, study. The controls are individuals who don't have the problem. The case are individuals who do have the problem. During this kind of study, researchers actually look backward to see if the people that have the problem, the case, had more exposure to something than the controls that may have caused their particular problem. As I mentioned, this study looks backward in time. Another way to say that is that this is a retrospective study. It's important to note that both the cases and the controls are matched as closely as possible. So when choosing controls, they're trying to match both the gender as well as the age and possibly location of somebody that has the particular problem. This is going to be the best kind of evidence for the etiology of some sort of rare disease, but it's important to note that this kind of study indicates association, but not actual cause. So exposure just indicates that you're more likely to have this problem, but it doesn't indicate that this exposure caused the problem that you have. We're going to look at case control studies and their appraisal more closely when we talk about studies of association and prognosis. An example of a case control study or a hypothesis for a case control study is also listed in this slide. You can imagine that cases and controls, in the case situation, the person would have Guillain-Barré syndrome. Control syndrome would not have Guillain-Barré syndrome. And the exposure would be exposure to a virus in childhood. They identified that is it possible that Guillain-Barré syndrome is more prevalent or associated with exposure to a virus in childhood. Moving on, now we're going to look at cohort studies. Cohort studies are so named because they follow one group of people or a cohort forward through time. They're considered a higher level of evidence than case control studies because they are prospective as opposed to retrospective. They can be used to identify diagnoses, prognosis, as well as etiology for diseases. And an example of a cohort study hypothesis is shown at the bottom of the slide. A hypothesis is children who receive less than 1 hour a week of physical education in grades 1 through 6 are more likely to become obese than those who receive more than 1 hour of PE a week. If you look at the picture of the cohort study diagrammed on the right-hand side of the slide, what happens here is there's one cohort of individuals. Some individuals received PE for more than an hour a week. Those would be the exposed, starting in the year 2000. And then there's the other individuals who did not receive PE for greater than an hour a week, starting in the year 2000. You follow this cohort of individuals through time for the next 4 years, and you're looking for the presence of obesity to be higher in those who didn't receive the PE than it is in those who did receive the PE. Great, we're getting there, almost to the top. Moving on to randomized clinical trials, or RCTs. Similar to a cohort study, an RCT is a prospective design. In other words, it's looking forward in time, as opposed to the retrospective study that was used with the case control trial. With an RCT, the main difference is you start out with a group of individuals, and these individuals are randomized to different groups. An example of a hypothesis would be that high-intensity walking training results in better walking recovery after having had a stroke compared to low-intensity exercise training. Think about this hypothesis if you look at the picture on the right-hand side of the slide. You start out with a group of patients, all of whom have had a stroke. These individual patients are randomized into a treatment group. The treatment group will receive the high-intensity walking training, and the control group will receive the low-intensity walking training. Follow-up occurs at a later period in time, and these individuals are screened to see if the high-intensity training resulted in better walking ability than the low-intensity training, and the results are compared by some statistical tests. We'll talk a whole lot about randomized control trials because this kind of trial is the most effective means for studying whether a particular treatment is going to work for a particular patient type. We finally made it to the top of the pyramid. Now let's finish up and talk about systematic review. A systematic review is a large study that combines many other individual manuscripts or works of. A systematic review is simply one large study where the authors have combed through the research literature via databases, which we'll talk about a whole lot later on. A systematic review is simply a large research study that combines the results of multiple other studies on a particular topic. Okay, it's not new research itself, it's just taking information that's already been published in the literature and compiling it into one major study. Even though RCTs are considered the highest level of evidence that we've talked about so far, other studies can be included in systematic reviews as well, because not all studies are able to do RCTs, or they might not have enough patients available with a particular problem to do an RCT. So cohort studies or case control studies can also, as well as case studies and case series, can be part of a systematic review. A special feature to a systematic review is a process called meta-analysis. And meta-analysis is nothing more than taking all the statistical results from the individual studies and analyzing those results as if they came from one big study. We'll talk about systematic reviews more as we go through the semester. And there you have it, all of the kinds of studies that we're going to be talking about throughout the semester and some of the limitations that they have, as well as some of the good features that they have. What I'd like you to do is go ahead and hit the next button at the bottom of the Moodle page and take a short quiz. Remember, these quizzes can be taken multiple times. They are open book and open note. The only thing you should not do when you complete this quiz is talk to another individual. All the information that you'll need to answer the questions in the quiz are covered in this PowerPoint.